Hi Lara, I'm Rosie. I'm a GP here at the practice. How are you?
I'm good, thanks. How are you?
I'm well, thanks. So we haven't met before, have we?
No.
No, I didn't think I'd seen you before. So where are you from? Are you from here?
Yeah, I'm studying here at the moment, so yeah.
Okay, you sat up at the uni?
Yeah.
What are you studying?
I'm studying primary teaching. It's my final year.
Oh, wow. So what's that? Is that 4 years?
Yeah.
Okay, very exciting. So why have you come in to see me today, Lara?
I just wanted to come for a general checkup. I haven't been to the doctor in a while. Also, I've been going to the gym a lot more than usual and I've been a bit sore, so I thought I'd check if that was normal or just something to worry about.
Okay, yeah, no, it's definitely a good idea to come in whenever you need to talk about anything. I think if you think there might be something wrong. So you said there's pain up here?
Yeah, just like upper back, I guess, my shoulders and neck, you'd say.
Okay, and do you have a doctor in Armidale that you usually see? Or you haven't been to?
I kind of just check in where I can get in.
Okay, and do you have any other medical problems? Do you take any medications? You on the pill?
Yeah, I'm on the pill.
Okay.
Nothing else. So
Okay, and what pill are you on?
Lovely.
Okay, and you don't have any? You're not allergic to anything? You don't have any other major
Not that
medical
I know
issues?
of, no.
Okay. So, because it's the first time you've been to see me, Lara, I'm just going to ask you some general questions.
Okay.
So, just about sort of your social life and your family, if that's all right?
Yeah, of course.
Okay. So, who are you living with? Or are you at college or?
No, I moved out last year. I'm living in a house in town with my boyfriend.
Okay. And how long have you been with your boyfriend for?
Quite a while now. A few years on and off, I guess.
Okay. And so you've been living with him just this year?
Yeah.
Yeah. And how's that going?
It's really good. I am enjoying it.
Okay, that's good. And so you live in a house in town. Okay, that's good. And in terms of your family well, do you have siblings?
Yeah, I've got 2 siblings
And
2 big brothers. They're healthy.
healthy. And your parents are healthy?
Yeah, very well.
Okay. And there's no family diseases that you know of that we should talk about?
I think there's a bit of breast cancer in the family, but
Okay.
I'm not worried about that.
Okay. So, in terms of your social well-being, you're happy? Everything's going well with uni? You're not too stressed out?
I guess no more stress than normal.
Yeah.
Studying's a bit exhausting, but
Yeah, no, I definitely remember that. And is there anything else in terms of your living arrangements or your social arrangements that you want to bring up just to talk about while we're here?
no, everything's fine. You don't need to be bothered with that.
Oh, no, definitely. We can definitely talk about anything you want to. That's what I'm here for.
I guess I've been a bit generally unhappy at the moment, but nothing serious.
Okay. Well, I mean, we all know in life you go through turbulent periods of up and down, don't you?
Yeah.
So is there anything that's been worrying you? Anything that's been making you feel unhappy lately?
Yeah, so uni's been a bit tricky and I'm in a bit of a rough patch with my boyfriend. You know how it is, you're never really super happy, it's on and off.
And living together is a big, it's a big move and it's sort of
Yeah.
hard to adjust to. Is there anything in particular that's happened that sort of started worrying you? Or?
No, we're on a bit of a down period at the moment. There was a bit of an issue a little while ago, but I think we're over that.
Okay. Is it something you want to talk about, the issue? Or?
Maybe. I've never really talked about it before. I thought if I did, it's a bit embarrassing, but he slept with someone else a few months ago and it's been kind of playing on me since then.
Okay. Well, definitely what you tell me in here, Lara, is between us, and don't be embarrassed because I've seen a lot of things and I'm definitely not coming to you as a judgmental character, so feel free to talk about whatever you want to talk about. So I'm just going to summarise quickly what you've told me and then we can keep talking about what you feel you need to talk about or want to talk about. So you've come in today to see me just because you haven't been to a doctor for a while. It's for a general checkup. You're a bit concerned about some back pain, but you think it might be due to an increase in visits to the gym. You're in a bit of a rough patch with your boyfriend, and there was an incident a few months ago, and you haven't really talked to anyone about that yet.
No.
Okay, so in terms of the incident, how are you're working through it in your relationship?
To be honest, I've just kind of avoided it. He apologised when it happened and we haven't talked about it since, and I didn't want to because we lived together and if something happened I wouldn't have anywhere to live, so I'm kind of just trying to smooth it over.
Okay, and in terms of the emotional hardship that you're going through, that's completely understandable. Is there anything else that you're worried about in terms of the incident?
I guess the only other thing, I don't know, I've never had any experience, would be we never use a condom because I'm on the pill and we're exclusive, but I didn't want to push him too far or ask him anything about it, so I don't know if when he slept with her it was protected or not.
Okay.
So I don't know if I'm safe or not.
Okay. So maybe, Lara, if you were interested, a lot of the time when girls your age come in, we do an STD test, and it's really simple. It's just a urine test, and we do a blood test as well. So maybe we could think about doing that.
Do you think that that would be the right thing to do?
Well, if you don't mind, Lara, I'm just going to ask you a few questions about your sexual relationships, because sometimes we can work out if that's appropriate to do an STD test in terms of how you relate with your partner sexually. So is that okay?
Yeah, of course. I guess, that would clarify things.
Okay. So you mentioned that you have slept with your partner unprotected in terms of condoms. Yeah. Okay, and you're on the oral contraceptive pill?
Yeah, I take that religiously, so.
Okay. I'm just going to ask you a few questions which might indicate a symptom that could notify that we need to do a more urgent test, but if you haven't noticed anything, then that's probably not the case. Okay, so in terms of your sexual relationship, you have, do you have anal sex or vaginal penis intercourse?
Just normal.
Okay. And you haven't noticed any symptoms, you haven't noticed any itchiness, redness, discharge?
It's been a bit itchy, I guess. Sometimes I get urinary tract infections, so I thought it was just that.
Okay, and do you go on medication for them often?
I normally just drink like cranberry juice and try and fix it like that.
That's good. Yeah, that's good if you can fix it yourself, definitely. So I'm not sure how much you know about STIs, but most or pretty much all of the STIs, even now HIV, AIDS, are treatable, so it's definitely not a big deal if that's something that we have to go down the path of. So definitely don't be worried about that. So has your boyfriend mentioned anything about? He hasn't mentioned anything about the risk of STIs or anything like that to you?
We haven't really been talking as much lately.
Okay. And what do you think's his viewpoint about the situation? Do you think he's feeling guilty and that's why you're not talking, or?
I guess he probably does feel guilty. I think he just wants to forget about it.
Okay. And how does that make you feel?
I feel a bit stupid. I feel, just silly for letting it happen and for not doing anything about it.
Yeah, it's hard. Everyone reacts to things differently, but you really don't need to feel that it's your fault or any blame on yourself, because, and I know that does sometimes happen in relationships, but we can work out a plan where we can talk about, you can come in once a week or once a fortnight to talk about how that's making you feel, because it's really important that you get on top of that, because you definitely don't need to feel guilty for something that's happened to you.
That would be really good.
Yeah, we can definitely think about that. So have you, in terms of other social support networks, have you drawn on your friends or your family to talk about this with? Or
it's hard. My family lives in Melbourne, so I only get home for major holidays and I don't want to bring down the mood with talking about my problems, so I haven't really talked about it to them, and I kind of bring it up with my friends from uni, but it's just embarrassing. I feel like I'm a failure because I let my relationship slip away.
Okay. I can understand that it must be really hard for you, Lara, but yeah, as I said before, you definitely don't need to feel that it's your fault, and I can be a person who's here to help you through that if need be. Just in terms of your relationship, are you planning on you're going to keep living together? You want the relationship to work?
Yeah, at least until I finish uni. Like at the moment, it's more of a necessity, but we have had such a history together. It would be a shame to see it go. Okay.
Yeah. No, well, that's, as long as you know that you have something to work towards and you know that you do have that past history of a successful relationship, and that makes it a lot easier to sort of attempt to work through it.
Yeah.
So, Lara, I'm just going to quickly summarise again what you've told me. So, in terms of the sexual problems that you're worried about, you're worried that your partner may have contracted an STI in a different relationship than the one you're in, and you want to have an STI test just to clear things up because you don't use condoms because you're on the OCP.
Yeah.
Yeah? Okay. And just a few quick questions before I start that. You've never been pregnant?
No.
No, never, no miscarriages or anything. and you're otherwise healthy. Yeah, and you've had a few UTIs, but you self-medicate with that, and that seems to work out. Okay. Well, from here, Lara, what I think we should do is to just do those 2 quick STI tests that I briefly talked about before. Does that suit you?
Yeah.
Yeah?
Yeah.
So, yeah, it's just a first stream urine, so I'll just give you a collection jar and you just, tomorrow morning or whenever you wake up, just collect some urine and bring it back and drop it in for me. And also I'm going to give you a pathology script to head down to the pathology unit and get some bloods taken. You've had blood tests before?
Yeah.
Yeah, and that's no worries for you?
Yeah.
Okay, great. And then when I get the results, I'll give you a call. I'll give you a call either way just so we can talk about things and maybe make a follow-up appointment. Yep. So does that work for you?
Yeah, that sounds good.
Okay, great. And is there anything else that you want to talk about today? Anything at all?
No, I think that covered it.
Okay.
Thank you.
That's okay.
It's nice to talk about it.
So are you happy with how the session's gone today in terms of what you've been able to talk about?
Yeah, I feel a bit silly for not bringing it up at the start, but you just never know how to approach it.
And everyone's different in, how long it takes them to get to that point where they feel comfortable to discuss what's happened or what's going on. So, you've definitely taken a step in the right direction by coming in to talk to someone about it and just, I know the niggling fear of, and also to get the fear of infection out of your mind. In the small percentage chance that you do have an STI, as I said before, they're completely treatable and everything should be fine.
Fantastic.
I'll get the scripts printed out and leave them at reception for you, and you can either make a follow-up appointment now or we can make one when I give you a call to chat about the results.
That sounds good.
Okay, I'm really glad you've come in today, Lara. It's been great to meet you and talk about your issues because talking is a great way to get over things, and I'm sure together we can definitely work through this.
Perfect.
Okay, thank you, Lara. It's nice to meet you. Good luck with everything. Okay.